When someone is hospitalized due to an overdose, what happens next? Joining us on Real Talk is Jenna Billingslea, a peer recovery coach who not only helps patients with their recovery and connects them with treatment, she's also a person in long-term recovery herself. Jenna,
Hi.
We're really happy to have you here on Real Talk. And one of the things I know a lot of people watching might not even know what a peer recovery coach is, let alone why they would be in the hospital. Can you give us kind of an idea of what you do?
Yes, I can. So I'm a person in long-term recovery. I'm also certified as a peer recovery coach. We work in the emergency room. Statistics show that often overdoses, fatal overdoses, have had multiple ER visits before their fatal overdose. So we are a program that works directly with individuals that come into the ER, substance use related concerns, opiate overdoses, and we meet with them to give them support and link them to different community supports as well.
Yeah, let me ask you this, if somebody comes to the hospital as a result of an overdose,
Yes.
whether it's being dropped off from an ambulance, what's kind of the process that you take right when they come into the hospital?
Sure, so we try to see them as soon as possible because sometimes when overdoses come in, they don't always want to stay. They'll leave against medical advice, so we don't really know. So we try to meet with them immediately. We don't try to tell them what to do, so we talk to them. We know they're at a low point, and we come from a perspective of understanding and empathy, and that's my approach, and say, what can we do for you? How can I help you? What do you need?
In most cases, are people very receptive to that? Because one of the things that I hear a lot, and I too am a person in long-term recovery and have experienced an overdose. So I know a little bit about the response after you've been revived from naloxone.
Yes.
So are they receptive, are they combative, or is it just kind of down the middle?
It depends. We have so many different kinds of people. Sometimes people, they're like, I don't want to be here, I need to go. My car's about to be impounded or something's going on. So we get their contact information and then I follow up with people in the community. So a lot of times I'm not sending people right to treatment or recovery supports from the ER. We follow up after. And once I can follow up in the community, sometimes people are a little bit more prone to accepting some help or making a plan for recovery.
For example, they come in, they've had the overdose, they've been released, you have the information, and then you reach out to them the next day.
Yeah, just to give continued support. And we also do Narcan training and harm reduction techniques as well. So I go and I distribute Narcan, I train individuals and their families as well.
One of the things that I think a lot of people, and maybe people watching, don't understand, they hear the word harm reduction. And it almost has a stigma attached to it as it relates to addiction. When you think of harm reduction for other things that we've done for years, you don't look at it that way. Addiction, it's a stigma. Can you explain what actually harm reduction is?
Yes, so harm reduction is the understanding that people are sometimes going to continue to use. So we get an overdose that comes in and they're not ready to stop using. But what are some techniques that we can put into place for this person to keep them safe and alive? So that would be something like Narcan. We like to give information on wound care. Keep your wounds safe, because when people are injecting drugs, they're prone to having a lot of open wounds. So we are trying to help keep them okay while they're going through this tough time. We give people information to safe needle exchanges, things like that. It works.
Yeah. I've grown to understand harm reduction more as I've done prevention work and things in the community. What's an example of someone comes in, they do have an overdose, and they are receptive and they want to have treatment. Are you able to place them in a bed immediately? Is there a way that they stay at the hospital until they get there, or are there other avenues that you take?
Yes, so we have an extensive resource list, but sometimes we can't get somebody in somewhere immediately to a treatment center. We work with a triage bed at part of Mountain Manor that we can send people to. It's kind of like a crisis bed where they can go and wait until they can get an inpatient bed somewhere. It's kind of like an in-between that we like to utilize from the hospital until they can get into treatment.
Kind of a tough question, but being a person in recovery, so you are in the community and not just doing the work that you do, but also being a person in recovery. Do you have any success stories, so to speak, that you have had someone come in and then down the road you've either seen them in the community or even possibly somewhere you might be?
Yes, I have. I've run into people in the grocery store. You know, recovery is an ongoing thing, so it doesn't just happen right in the ER, and that, you know, it's a process. So I've worked with individuals before who I didn't meet with in the ER, but I met with in the community, and they might have not been ready for treatment at that time, but a couple weeks down the line with continued support and family support, they ended up making the decision to go inpatient, and they're actually still there now.
Yeah, that's awesome. A lot of times I've seen in the work that I do, people might not be, like you said, receptive right when it happens, but just making yourself available and being someone to talk to makes a big difference. And that's kind of what a peer does. I mean, it's just let them know you've kind of either walked down that road. So we're really glad that you have come out and shared kind of your duties that you do at the hospital. I'm really excited to let people know that we have this at the hospital, because everybody doesn't realize that we have peer recovery people at the hospital.
Yeah, it's a new program. We started about 2 years ago or so. It was interesting when we first started because nurses and certain people didn't quite understand our role. And we said, well, yes, we're actually in recovery ourselves. They were a little bit taken aback because they thought, oh, well, you don't look like a person, you know, who was a quote unquote substance user. And it's like, well, they don't have a look. You know, it can kind of happen to anybody. And that's kind of what we're here for too, is to break down the stigma.
Yeah.
Is that it doesn't affect just one kind of person.
That's exactly right. Well, thank you for coming here. Thank you for helping break the stigma.
Sure.
And I think we need to all be open, people in recovery, and share stories so that people know that there is help out there. So thank you very much, Jenna.
Absolutely. Thank you for having me.
Recovery is possible. And with the help of peer recovery coaches like Jenna, there is even more support for patients in our community to succeed.